Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is with you, and we are discussing situation in the West Asia, particularly the war on Iran by Israel and USA, and it is almost a 15th day. The war is entering into third week, and we have looked at the public health and other difficulties the healthcare system of the Iran is facing, and we want to draw some conclusion that in future, if such situation occurs, then whether the medical education given for the peacetime is applicable during these turmoil or these conflict situation. And we have multiple conflicts in the world, and ultimately every conflict will be converted into a medical emergency, and the burden of the patient's bullets, injuries. But the delivery and vaccination is a normal vaccination program, and that should not be halted. So let us start with the presentation, and now it is ready. Uh, so let us start healthcare under siege, vaccination and newborn healthcare in Iran. Managing during conflict 2026 means this is a situation in which the vaccination and newborn care are the deliveries and other MCH care, maternal and health care is one of the important area, and it is also public health, and 70% patients are mother and children in every society. So let us move, and you can see that how the hospitals are broken, and even a child uh, picture is on the wall, and that is a situation. So let us see. Conflict starts on 28th, and it is 14th, so almost 15 days has passed. Health impact: 10 hospitals damaged, 77 facilities affected, means 10 almost finished, and 77 a partial damage or a big damage. Child casualty 180 plus, and many more injured, means if the casualties are there, then you can multiply with 100 injuries. Supply crisis: 70% medicine import reduction, uh, and stoppage, clinical shortage or medical shortage. So, in that situation, how healthcare is managing: maternal services are disrupted, hospital evacuation is there, neonatal care in crisis, and nutrition programs halted. So these are the four areas where the most vulnerable children and mothers, particularly children under 5, they are suffering, and they are not part of the war. They are responsibility of the international community. Supply crisis details: medical shortage 70% already, import reduction to vital medicines, fuel shortage, and then distribution halted, infrastructure collapsed, power outage, equipment damaged, and early discharge of the patients. And it has been that the shadow supply system is supplying these medicine, means not through the regular channel or through the trade routes, but there are underground routes. So that is another area. We have heard that narcotics and other things and human trafficking is going on above and below the law, but this is another area where Iran is getting some supply through these hidden channels, or they call it shadow channels in Iran. So this chart shows that before conflict, you can see the blue bar, and the red you can see the after the conflict. So vaccination, it was almost 90%, but it is still 30%. And that is amazing that even in the war conflict, the vaccination is being carried out in the Irani health system. And that is very sensitive indicator that still it is intact. And then maternal health, it was almost 70%, but it is also 20-25%. And neonatal care is suffering most. It was 70% and now it is 10%. And this is a apathy of the war. Even the premature births are there, and doctors are giving in the last trimester the mothers cortisone. That is a new information coming from that, so that their lungs are protected, and if early birth or premature birth is there, then their respiratory and the breathing system is intact. Emergency services, you can see they were almost 100%, but now still they are at a 50%. So after 15 days, bombing of the thousands of the missiles and drones and cluster bombs, if the emergency services are working at 50%, I think the Irani people and average capacity loss is 65%. So you can see that the resilience under fire, but the health system is 50% still functional in Iran. Then what the WHO says, the Dr. Tedros Adhanom Ghebreyesus, WHO Director General, we call on all parties to protect health facilities, health personnel, and patients at all times. The best medicine is peace. I think that is the strong message and pathway to protect immediate, short term, long term. It is the humanitarian and the medical corridor to be restored in Iran, so that the medical supply and even the doctors, they are protected. This is immediate, and even vaccine and other supplies be restored. And then the short term, the healthcare facilities, and they can be protected, and long term under the international law. I think the review committee and fact finding be allowed to see what are the problems there. So with this, I think cannot wait. Key actions: protect health facilities under international law, establish humanitarian corridor for medical supplies, resume vaccination program immediately, support maternal and neonatal newborn health services. Every child deserves a chance to live and to survive. So with this, I think we are ending this meeting, and hopefully you will have an insight. Once again, I am showing the message of the Dr. Uh, uh, Adhanom, Dr. Tedros, that the peace is the medicine, and the healthcare system of the Iran has shown to the world that even under extreme threats, medical care, vaccination, newborn care is possible. If not above the surface of the ground, they have made bunkers as well as tent hospitals, underground hospitals, resilient to heaviest bombardment of any power. So I think the doctors of the Iran, they deserve appreciation and courage, but we will stand for the peace, and we are against the war. We are against killing any life, whether this is on this side or on that side. Every life is in Quran also it is said that if you save one life, you have saved mankind. And if you kill one life, then it is killing the total humanity. So Irani life is connected with the mankind life. So Europe and other countries, they should play their role, and they should bring the USA from the um, outrage and from the anger and from the power intoxication or nostalgia to the humanity level, so that they can understand that the life of the Trump and life of child in Iran or anywhere in the world is as sacred as anything between sky and the earth. Dr. Hussain Bashkolachi YouTube channel is there, and as a Pakistani doctor, my sympathies are with the Iranian doctors, and I will request the medical fraternity of the world, they should put their pressure and should contact with the Iranian doctors for any rush call, for any emergency call, so that their life and their country, their integrity, sovereignty, and the professionalism is saved. Thank you very much once again. And if the meeting is showing me, I think I am thankful that we are ending this, and we will continue to give you updates from the window of the health and public health, what is going on apart from other political and other things. Please like, share, and drop comment in which country you are there. And if you are from Iran and listening to this video, please drop your comments, or from any other part of the world. Thank you very much, Dr. Hussain Bashkolachi, once again from Pakistan, saying peace and health of every person, every citizen, everywhere in the world. Thank you.